This is a 24/7nursetutors.com lecture. 24/7 Nurse Tutors, providing unlimited tutoring.
Welcome, and thank you for joining us. Musculoskeletal System, Part 1.
Look at the picture on your screen. Tell me, what is the function of the musculoskeletal system? The musculoskeletal system not only provides form, but it provides support, stability, and movement to the body. Can you guess how the skeletal system and calcium and phosphorus are related? The skeletal portion of the system serves as the main storage depot for calcium and phosphorus. It also contains critical components of the hematopoietic system, which is blood cell production. Remember this because it will help you answer a lot of NCLEX questions and NCLEX style questions. I repeat, the skeletal portion of the system serves as the main storage depot for calcium and phosphorus and contains the hematopoietic system. The muscles of the muscular system keep bones in place. They also play a role in movement of the bones by contracting and pulling on those bones, allowing for movement like standing, walking, running, and grasping items. To allow motion, different bones are connected by joints. Within these joints, the bones are connected to other bones and muscle fibers via connective tissue such as tendons and ligaments. Cartilage prevents the bone ends from rubbing directly on each other. Muscles contract or bunch up to move the bone attached at the joint. What is a fracture? Well, simply, the term fracture denotes a broken bone. But, by definition, it refers to a break in the continuity of the bone caused by trauma, twisting, indirect loss of leverage, or bone decalcification. I was surprised to find out that in the U.S., greater than 250,000 hip fractures are reported yearly. Fracture occurs when force applied exceeds the tensile or compressive strength of the bone. Tell me, class, what causes a fracture? Yes, falls could cause a fracture. What else could cause a fracture? Sure, sports injuries like football, soccer, even basketball can cause fractures. A motor vehicle accident and even disease can cause a fracture like osteoporosis or osteopenia. Can you give me some examples of a traumatic fracture? Yes, it's a fracture we might see in an accident, such as a four-wheeler. Traumatic fractures are caused by sudden injury or trauma. What is a pathological fracture? This is a fracture that would occur in a diseased bone. Because the bones are weakened, any kind of little trauma can cause the bone to break. Sometimes you may see a person fall and their hip is fractured. But guess what? The patient's hip broke before they fell. It was not the fall that broke the hip. Common sites of pathological fractures include spine, neck of the femur, pelvis, ribs, and the humerus. What do you think a stress fracture is? A stress fracture is a tiny crack in a bone that usually happens from overuse. It is caused by repeated trauma at the same site. Stress fractures are classically associated with constant impact sports, such as running or jumping on hard surfaces. We can also see them in dancers and horse riders. In regards to clinical classification of fractures, we have two types: closed or simple fractures and open or compound fractures. In a closed or simple fracture, skin over the fractured area remains intact. Here there's no risk of infection or osteomyelitis. It's comparatively safe. In an open or compound fracture, the bone is exposed to air through a break in the skin, and soft tissue injury occurs. Here, infections are common. Did you ever see that YouTube video of the young man who went to shoot during a basketball game, came down badly, and had an open fracture? It was so sad. I remember having a patient who had a history of RTA, which means right traumatic amputation. His broken humerus was visible, breaching the skin as it was badly fractured. Now tell me, what type of fracture is it? Yes, it's an open or compound fracture. On the screen are the more common fractures that you may incur as a nurse. They include the transverse fracture, a linear fracture, an oblique non-displaced fracture, an oblique displaced fracture, a spiral fracture, a green stick fracture, and a comminuted fracture. Please tell me, what are the signs and symptoms of a fracture? Well, if the bone is sticking out, we definitely have a fracture, right? But we also may see pain, swelling, discoloration, deformity of the extremity, restricted movement, loss of function, and fracture evidence by X-ray. Complications of fractures include fat embolism, compartment syndrome, infection, osteomyelitis, avascular necrosis, pulmonary emboli, venous thrombosis, and delayed union and non-union. If you don't remember anything I teach you about fractures, please do not forget compartment syndrome. Why? Because acute compartment syndrome is your medical emergency. I will say it again. Acute compartment syndrome is your medical emergency. Remember what your teacher said? She said for NCLEX, know your medical emergencies because that will keep your patient safe. So what is compartment syndrome? Compartment syndrome is when pressure builds up inside a muscle compartment. What makes this an emergency? Because within 6 to 8 hours, we can have irreversible damage. Nerves within the compartment can be compressed and damaged. If untreated, The muscle can be permanently and irreversibly damaged and can die. This is called muscle necrosis. Clinical features include severe pain on extending the digits, the fingers and toes, distal to the injury. This is a reliable clinical sign. A loss of pulses and/or loss of sensation can be late. The most common sites for acute compartment syndrome is the forearm and the muscle compartments surrounding the tibia and fibula. Here's something else very important concerning the assessment of compartment syndrome. Don't forget these 7 P's of compartment syndrome. Pain and tenderness. Pulses. Are they absent or present distal to the fracture area? Pallor. Paleness of the skin. Paresthesia. Distal to the fractured site. Paralysis. Poikilothermia. Do we have any temperature changes? And pressure. Is the client complaining of increased pressure and tightness? Remember, you are more than a conqueror and you will be successful. Join me as we review core content in the next unit.